Okay, hello everybody, and thank you so much for joining us. My name is Stephanie Garner, and I am the Director of Parent Support and Education for Down Syndrome Indiana. And I am really excited today to be joining you for improving knowledge about dental care needs for people with Down syndrome. And one of our very own parents is doing the presentation for us. So, Sophia, I'm going to hand it over to you, and I'm going to let you do your own introduction because you have exciting news to share with everybody. So we will be saving questions for the end. So you're welcome to type those in the chat box if you want, and then we will go through those at the end of the presentation. And if you have more private questions, we can definitely stop the recording before you ask those if you don't want it to be on the recording that we share with everyone. So, Sophia, I'm going to hand it over to you, my friend.
Perfect. Alrighty, guys. So I am going to share my screen with my PowerPoint. Alrighty. So, yes, this is improving knowledge about dental care needs for my child with Down syndrome. And my name is Sophia Twaddell. I am an expanded functions dental assistant, and I will be graduating soon with my registered dental hygiene license. So, a little bit about me. I will preface. One, I am very nervous. I have not done any sort of presentation kind of outside of a school setting. So I am very excited to do something like this and kind of do some community outreach. Um, but yes, as Stephanie said, my exciting news is that on Thursday I'll be 32 weeks pregnant. So I actually received a prenatal Down syndrome diagnosis for my baby girl, and her due date is Christmas, and we're so excited. So, like I said, I'm an expanded functions dental assistant. I'm set to graduate on December 13th, so I'll be cutting it pretty close as far as my due date is concerned with having a baby. I guess we just wanted to get it all done in 1 year. So I've always been very passionate about special needs dentistry, and I've kind of worked a little bit in a pediatric office, and then I've had rotations with some special needs patients, and kind of finding out about my own daughter and her diagnosis. I really wanted to use this as an opportunity to help educate and connect with my newfound community. So a little preface is that I'm still learning much about the Down syndrome community and am learning how I can use my profession to help others within the community. And I may not have all of the answers to the questions, but I am more than willing that if I don't have an answer, I can find somebody who does. So even if that's not today, um, Stephanie can connect us via email or something, and I can get your questions answered. I have, especially being at the school, I have met a lot of great people who have kind of helped me with this topic. So I have pretty good connections. So those are my cats down there. That's Meatball sticking out his tongue and Peach. And then on the left, I have some 3D ultrasound pictures of my baby girl. And you can kind of see in the second one, she's like sticking out her tongue a little bit. Okay, so I have a pre-presentation survey. It's kind of a little long. It's like 15 questions. It is completely anonymous. You only answer what you feel comfortable with. And this kind of just helps me going forward what I could focus my education efforts on better, how I can do a better job providing advocacy. So several times throughout that survey and also throughout this presentation, I refer to your child. If you have an adult child with Down syndrome, I am also referring to them. It is all encompassing. I just am using that verbiage because I'm assuming you are the parent of somebody who has Down syndrome. So I also have that link. Um, I will leave that up for a second. And if you want to do that, totally cool. If not, no big deal. Just something for my purposes for future things I want to do. So, I will go ahead and get started with some of my information. And like Stephanie said, if you have any questions, um, feel free to type them in the chat box or you can save them for the very end. But my first slide is just how does my child's mouth differ from others? So we have some anatomical differences. Macroglossia, which is kind of like an enlarged tongue. And children with Down syndrome often have relatively larger tongues due to low muscle tone, or they might have smaller oral cavities, which can kind of like present as a larger tongue. It might not be true macroglossia though. And then they could also have a narrow or vaulted palate that kind of just has to do with some abnormal craniofacial development and growth. That can kind of crowd the teeth and alter the bite. Um, and then we have dental deviations. So there could be delayed or irregular sequence of eruption, which tooth eruption is commonly slow due to some of those developmental delays. There could be congenitally missing teeth due to that as well, irregularities in tooth formation, underbite, overbite, or crossbite. So in that picture that I have on the left, that kind of is more demonstrating that underbite, where the bottom jaw kind of protrudes out a little bit further than the top jaw, which can contribute to some malocclusion and like speech things. And then they could have space teeth. So the smaller teeth in combination with the macroglossia, there could be some spacing. There could be open bite where the teeth actually like are open here in the front. Excuse me. Some other considerations, there could be TMJ dysfunction, which is that joint here in our jaws that can get sore sometimes. There could be mouth breathing, periodontal diseases, which I go a little bit further into in the next couple slides. Poor oral hygiene due to some of that low muscle tone and like motor function skills. Bruxism. There is actually a lower rate of dental caries within the Down syndrome community. And that kind of has to do a little bit with delayed eruption and wider spaces between the teeth, reducing food accumulation. I will also warn you might hear my cats at some point yelling outside the door. Okay, so the next slide I have, and I'm trying to make this as interesting as possible. I know that some of this information can be a little bit boring, but I just feel it's important, especially with the periodontal diseases, because that is something we see higher rates of in childhood. So, why is my child at a higher risk for them? So, periodontal diseases include periodontitis and gingivitis. And periodontitis is inflammation of the gingiva in combination with bone destruction and loss. So, that is staged and graded based on severity. So the stages are 1 through 4, the grades are A through C, and it kind of indicates severity and then progression rate. So how fast is it causing loss? And that bone loss can never be reversed, but it can be arrested, and that's done through something called scaling and root planing. And that is basically like your deep cleaning, which some people might be familiar with that, but a lot of the time that is done in quadrants. And if your child is able to uh, tolerate dental treatment pretty well, that is usually done just quadrant at a time. The only, I guess, curb to that is we usually like to use anesthesia for that, like local anesthetic, which most kids really don't enjoy that. But it can require general anesthesia if your child is not as tolerable for dental treatment. And I do have a couple slides on general anesthesia because I think it's important and it is a very useful tool for people with special needs to be able to get the care that they need. So we'll go into that later. But so periodontal diseases are present and prevalent in genetically typical children, but there is an influx seen in people with Down syndrome just due to it's a couple different factors. So one of the studied factors that I have seen in some of my research has to do with the immune dysregulation seen in people with Down syndrome. And then when that immune system is compromised, those pathogens are kind of opportunistic. So they take the opportunity to cause that destruction in the periodontal ligaments. So the precursor to that bone destruction is gingivitis. So we just want to make sure we keep that oral cavity very healthy and free of gingival inflammation. And that's like the most effective way to kind of curb some of this. So um, another thing that's been like studied with periodontal diseases and those specific bacteria is that these pathogens can be transferred from mother to infant, and that there is an increase in childhood periodontal diseases if the mother has a periodontal condition, especially gingivitis, and that can be from saliva, especially from like kissing, sharing utensils, if you're trying something hot and to make sure you're trying a food to make sure it's not too hot for your child and then giving it to your child, that can actually cause some cross contamination with pathogens and pass that on to your child, which I think is interesting, but it's just another reason why we don't want to be spreading germs. Alrighty. So here I have some examples of some adaptive tools, and those adaptive tools can kind of provide better dexterity and more effective angles and means of plaque removal. Um, so I have toothpaste without sodium lauryl sulfate, which that is a big complicated chemical word, but basically that's the ingredient in toothpaste that makes it foamy, which some people really like that foamy feeling. It's kind of just like a texture sensitive toothpaste. And in my experience in pediatric dentistry, that those kinds of things are very effective for kind of eliminating some of those just like bad texture feelings. So one of the pictures I have over here is a product called Aura Nurse. Um, and that is a no texture toothpaste. I believe it might be also no flavor because I know there are also some flavor sensitivities. Um, Something, and these are just things I have found on Amazon, is like a modified toothbrush grip. So you could either get ones that have a larger grip, or like I have pictured is a handle grip. Um, and I really like that because it kind of provides autonomy with the child being able to, do their own brushing, get that feel for how it feels. Um, and Philips Sonicare actually makes a app um, with their children's toothbrush. So I don't know if you see the little purple guy, but that is like the pet that they take care of when they brush their teeth, and he likes really shiny teeth. And the only way that you can make him happy is to make sure you're brushing your teeth. And it has like little interactive games and stuff so that you can your child can visualize where the toothbrush is going. It just makes it a little bit more interesting instead of having to sit there for 2 minutes. um I like electric toothbrushes a lot. I feel like it takes out some of the work as far as the dexterity because you can kind of just run it along and it kind of does the work for you. Um, and then I have floss holders, which again, the dexterity, sometimes that string floss, even just people day to day, some people don't like having the floss around their hands, so that floss holder is pretty nifty. Um, they're not entirely necessary, but they do improve comfortability and effectiveness of the home care. So, what are some other modifications for home care? Like I said, those adaptive tools, and then like a visual flow chart. So, this is actually one that I have made, and I can get out a little PDF if you guys want to print this off for your child or anything, or provide that. But basically, just providing step by step, having a nice routine of what they need to do each time. Um, you can either put a piece of paper on it, cover it up so that they can't see the next step until they complete it. I also like a timer just as another visual cue for how long they should be brushing. Um, like I kind of talked about with that electric toothbrush with interactive elements. Caregiver assisted. This is one that I kind of wanted to make sure I kind of hit home, is that oral care really should be assisted, especially for people with Down syndrome, kind of into adulthood. That low muscle tone, and it kind of just creates barriers for dexterity for being able to reach certain areas of the mouth. Really, people should be doing that with genetically typical children as well. I know that is not always the case because kids kind of want to do their own thing, but I think doing their own round of brushing, and then coming in and following it up by the caregiver, to assure that complete oral hygiene is achieved. That way, they're not missing like right by their gum lines. That's a really common area, especially here in the front. Kids like to miss where because their lips like to tighten right there. Um, and then my last thing, and I do have a little bit more about that, is daily fluoride use. And I included my little extra tidbit, um, because I feel like I get a lot of questions about fluoride use, when I'm working in the pediatric dental office, um, about, you know, how much fluoride is appropriate, how much toothpaste should I be putting, when should I start using fluoride toothpaste. So I feel like there is just a lot of information out there, um, that can be a little bit tumultuous as far as what should I do and what shouldn't I do. So I think, everybody should do their own research, but I just wanted to provide some information. Um, so this is how much fluoride is recommended per day for like going by age. So, from an article on fluoride toxicity from the National Institute of Health, um, the average intake of fluoride from toothpaste, like every time a child brushes their teeth, the amount that they end up digesting from swallowing is usually around, it's 0.625 micrograms per pound for adults and around 5.2 micrograms per pound for children. And if you do the conversion for that, there's 1,000 micrograms in a milligram. So for a 30-pound child, that the considered like probable toxic dose, and by probable I mean like that could cause like stomach upset, diarrhea, that kind of thing, that's 68 milligrams of fluoride, which is kind of a lot. um, but the amount that a child is consuming every time they brush their teeth is like 13,000 times less than the amount that is considered toxic. So I try to really hit that home for parents that, if your child is swallowing the toothpaste that you use, it's not going to hurt them. Now, if that same 30-pound child was going to sit there and eat an entire tube of toothpaste, that would be a problem. There's about 100 milligrams of fluoride in a full tube of toothpaste. And, they market them with bubblegum flavors and strawberry flavors and things that make brushing your teeth more appetizing. Um, and so this is what is recommended for how much toothpaste you should be putting on the toothbrush. From birth up to 2 years is a grain of rice. For 2 to 6 years, it's like the size of a pea amount of toothpaste. Over 6 years, you can you like put a full amount of toothpaste on the brush. And this is my point with this, is that you should always supervise your child when brushing. Keep toothpaste out of easy access areas. The last thing you want is to have to call poison control because your child ate a tube of toothpaste. So, real quick before I switch off of that, um, like I said, kids with Down syndrome do tend to have a lower caries risk. However, um, preventing the need for extensive dental care is going to be top priority, especially when, they might not be able to tolerate those longer appointments, or they might need to go under general anesthesia if they have extensive dental needs. So, doing everything in our power to kind of prevent these things from happening is why I like to hit home on fluoride so hard. I know that there are things out there, but I just wanted to give my 2 cents on that. Okay, so off of the fluoride topic, we have some nutritional considerations. Um, And then, that's the same for genetically typical children. Nutritional counseling is completely crucial for prevention of, excuse me, periodontal diseases and tooth decay. So, one of the biggest factors for dental caries is frequent fermentable carbohydrate exposure. And so, what are those fermentable carbohydrates? Those are sugars and starches that the oral bacteria can break down to produce acids, and that can be things like crackers, fruit snacks, granola bars, candies. Um, I know Halloween is coming up. I'm not saying don't give your kid any Halloween candy. That's not what I'm saying. I just want everyone to be aware that there should be a nice balance, and that, rinsing with water, ensuring we keep up with the dental hygiene, that is going to be um, very helpful there. So, some alternative snacks that I like to recommend is like fruits and vegetables. Um, fruits still have sugar, so you don't want to just continuously be giving your kid fruits. Just make sure their diet is well balanced. And then yogurt and cheese, they actually have something called anti-cariogenic properties. So they actually help fight caries. Anything kind of dairy related kind of offsets because of like calcium content, just other minerals and stuff. So there is that part. Don't think I had anything else to add to that. Um, this was actually something that the pediatric dentist that I work for said that I should definitely mention is should I start bringing my child to the dentist? And a dental home should be established by 12 months of age or upon eruption of the first tooth. And, especially with that delayed eruption, your child may hit 1 year old and not have any teeth. And we still want to see them in the dental office because that kind of gives us the opportunity to implement some individualized preventive care so that, we can get a game plan together for, why haven't their teeth erupted? Um, are they congenitally missing any teeth? We wouldn't necessarily establish if they were congenitally missing teeth probably until a little bit later, but um, it's to establish routine care and to reduce the risk of possible dental and oral disease. So how might my child's dental office visit differ from others? So, you might require shorter, more frequent visits to build comfort and reduce stress. At my office, we have something called happy baby visits, and we do that for not even just babies. If we have a patient we feel could benefit from coming into the office and just kind of being there to see how it is without any dental care happening, we are more than happy to do that just to make them more comfortable. So, dentists with special needs training may be required. I would say that most pediatric dentists should have some extra training involved with special needs. Um, we'll kind of talk about adult special needs care as well. That is a bit more of a in-depth and complex one, but some extra care with positioning. We want to make sure that, especially for our younger patients with Down syndrome, that we are supporting their neck and back vertebrae. And then extra time may be needed for medical review before any procedures. So that would obviously be done very extensively for like general anesthesia. But if you're a new patient, maybe getting that paperwork in beforehand so that the dentist can review if there are any heart conditions, lung conditions, just anything that we need to be aware of so that we can make sure we're not causing any further issues. We might need some extra time for communication and trust building, visual aids and step-by-step explanations. I made one for home care. At my dental office, we have one in office that's just a couple steps of like you do your cleaning, you get your exam, and now you get a prize from the treasure box. That prevention focus, I feel like I've hit that pretty hard. And cautious use of sedation like nitrous oxide. A lot of the time that can be actually contraindicated. And general anesthesia may be required for more intensive treatment procedures. So, what are some things I can do to prepare for my child's dental appointment? Share. We want to share your child's full medical history. Don't leave anything out, even if you feel like it's not pertinent. It is pertinent. I promise you it is, especially things with the heart, just because um, the heart is so close to the mouth as far as blood circulation. And I feel like I spend my days at the dental school trying to explain this to adults who don't understand why I'm asking them XYZ about their heart conditions when I'm cleaning their teeth. So, bring we want to bring comfort items and adaptive tools that can be used to reinforce home care. So maybe you do have that handle at home and you want the dentist to kind of show your child how they can better be using that. Just anything to kind of reinforce that. Practice. We want to practice at home too. I know there are really cute, like little, like play dentist kits that you can do at home, which I think they're adorable and can kind of help at least get them in the mindset of like, this is how it goes. You lean back in the chair, you open your mouth for the dentist. Schedule at the best time of day when your child is most calm and cooperative. I find that usually that's like first thing in the morning when we open, but maybe your child is very grumpy when they wake up in the morning, which I have also seen quite frequently. So just that's more based on what you think as a parent. Ask. You can ask about shorter or practice visits to ease your child into dental care, and advocate for your child. You know your child best. You know how um, we can accommodate for your child. And I would hope that whoever you encounter in the dental world will be willing to do that. Um, and I think that as providers, that is one of our duties. And if you don't think that is being done for you, then it may be time to find a different place. So, what can advocating for my child look like in the dental setting? I kind of already touched on this a little bit, but finding that balance between completing what is necessary to benefit your child and keeping your child comfortable in the dental office. Um, the last thing we want to do as providers is push. And what I mean by that is, I don't like upsetting children. I know there is a fine balance between getting done what needs to be done because um, it's for the benefit of the child. And even though they might not completely understand that because, cognitively, that is just not something they are at an age or at a understanding of. Um, and that is also parent dependent. If you are not comfortable with the way that care is being conducted, then please speak up. I know that is difficult sometimes because we think this person knows what they're doing, they're a professional, you don't want to seem rude, but at the end of the day, you are the parent and you know your child best. So, part of a successful dental care appointment is recognizing the difference between a person's normal emotional response to treatment and a true inability to tolerate or safely undergo a procedure. So, and this is that fine line of, my child is upset and crying and doesn't want to do it, doesn't want to get it done, um, but the provider can get it done, or um, like true distress, meaning they cannot tolerate treatment. So we have expected distress in situations where a person's comfort or safety requires us to pause or adjust the approach. If they're grabbing at our instruments, if they are swinging their arms, if um, the actual opening is just not tolerable, we try and look at different approaches. So the goal is to establish routine in office dental care, and that's for us to know what to expect. Not every person with Down syndrome will tolerate the treatment every time, but knowing what they will and will not tolerate allows dental personnel to create individualized treatment plans that work for your children. This way, they can carry this into adulthood and transition easily into an adult dentist if applicable. So, yeah, it just kind of is knowing when your child is just upset, they don't understand why they have to be at the dentist or open their mouth or maybe have an x-ray that's uncomfortable for 2 seconds, and situations where we simply cannot get the work done that needs to be done. So I have a couple slides about general anesthesia, and in general, I feel like there are usually questions about this. So overall, there is a more streamlined process for pediatric patients. And this kind of goes into because specialized training for pediatric dentists is often more in depth for special needs patients rather than just general dentistry. And general anesthesia is something that pediatric dentists already offer for young patients intolerable to dental treatment for reasons other than a disability. So, pediatric patients with Down syndrome tend to have less comorbidities than adults with Down syndrome due to the development of conditions over time. And this is kind of what I wanted to touch on with adults with Down syndrome needing special needs care and care under general anesthesia. And what I have found in kind of doing some of my research for this is how giant of a gap there is in the dental field, um, whether that be the number of resources available, the coverage available. Um, I'll get a little more into that in a second. So, conditions like sleep apnea make going under general anesthesia riskier due to the possibility of airway obstruction. And those kinds of conditions do tend to worsen as somebody gets older. And another consideration is bradycardia, which is that slowing of the heart rate during general anesthesia, which is expected, but um, it is a little bit more prevalent in those with Down syndrome, especially with congenital heart defects. That's when we start to get worried about, risk versus benefit of going under general anesthesia. Are we putting the patient more at risk by having them under versus what they need as far as their dental needs go? Um, so many of the risks associated with adults with Down syndrome are applicable to children as well, but the comorbid conditions just tend to worsen with age. And all of that being said, sometimes general anesthesia is unavoidable for the treatment necessary for the patient. So, I also tried to look into insurance for some of this. And this is maybe a little bit more of an unfamiliar area for me, but I did learn a lot doing this. So, there are several private insurances that have their own processes cut out for what they will cover as far as general anesthesia is concerned, but many follow a set of hoops that you have to jump through for getting general anesthesia covered for pediatric and adult patients alike. And some of the factors that kind of influence whether general anesthesia will be covered. Um, Insurance has to consider the anesthesia as medically necessary, not just for comfort or convenience. Um, the medical, physical, behavioral, or developmental condition of the patient may need to show, that there are may need to show that local or more simple forms of anesthesia are insufficient for the treatment of the patient. Like I said, as far as like nitrous oxide and such, that can be contraindicated for patients with Down syndrome. So that might be just one thing that you just have to show, like that is insufficient. And the dental procedure may need to be complex, extensive, or in a surgery setting, and most of the time that is. Pre-authorization is often required. The provider must meet certain credentialing, documentation, or billing requirements, and some services may have special rules or circumstances affecting coverage listed in the plan. This is, I think, yeah, this is my last little tidbit about that. So this is specifically for Indiana Medicaid regarding general anesthesia coverage for dental work. I would say it's pretty similar across the board. There might be little differences and nuances between insurance companies, of course. But general anesthesia for patients 21 and older definitely requires a pre-authorization, and reimbursement for codes for general anesthesia limits procedures to take place in an outpatient, inpatient, or ambulatory surgical center And there are certain Medicaid plans that require the general anesthesia to be made justified by the provider. Um, the pre-authorization is not necessarily required for pediatric patients, but the treating dentist or oral surgeon still requires documentation of medical necessity. So I have provided a link for that Indiana Medicaid coverage for dental services, and then page 12 kind of states what dental services are subject to prior authorization, general anesthesia being one of those. So that's my really boring tidbit about insurance. Um, and I have some resources for some special needs care. And I have clearly more listed for pediatric patients. So there is Riley Children's Health Dental Clinic. Some might have experience with that clinic already. They are really, really good with working with special needs patients. And I will also say that all of the ones I have listed under pediatric um, do accept Medicaid, and that is something I specifically looked for, just because I think it's really important, especially with how many therapies and other doctor's visits our kids with Down syndrome require. I just think it should be all encompassing, but it is not always the case. So Riley Children's Health Dental Clinic is located downtown. I included Hoosier Pediatric Dentistry, and that is the dentist that I work for, or I should say worked for. I am now taking a break as I am 32 weeks pregnant and cannot run around with the kids anymore. So the doctors there are Dr. Joshi, Dr. Masabni, and Dr. Scully. And I really loved working for them, and I highly recommend them. They book out pretty far. You're going to find that many of these places book out pretty far just because the demand is so high. And I was not hesitant, but I wanted to include more resources. I just don't have personal experience with Park Pediatric Dentistry or Fisher's Pediatric Dental. But I did research them a little bit, and they do have special needs training. They do accept Medicaid, and they did have good Google reviews from what I had seen. So I just wanted to put that out there just because I don't have personal experience with them, so I don't know how they are as doctors. But I know that sorting through the list of special needs dentists and also accept Medicaid and also do general anesthesia, it can be incredibly overwhelming. So the one thing I will say is that most pediatric dentists have some sort of referral process for general anesthesia dentistry in a hospital setting. If they don't do it, they know somebody who does and can get you referred. And then one of the doctors that I talked to at the IU School of Dentistry was Dr. Downey. And I think I had kind of mentioned at the beginning, the school is very much under construction right now. And part of that construction is making a special needs clinic that is going, I believe, either on the second or third floor. And I think that they're trying to open that either next year or the year after that. But she is one of the driving forces behind that. And they still are doing hospital dentistry. It requires a referral from a general dentist, and bookings can be several months to a year out. And when I asked her if she knew of any other dentists that provided special needs dentistry, general anesthesia for adults in the Indianapolis area, she said, "Let me know when you find one." So I could understand how that is quite frustrating. And it really just shed a light for me how big of a gap there is for some of this special needs care um, in Indiana, and I think it's kind of in general. So I have kind of found like a newfound passion for where I plan on taking my career. I have an offer for afterwards, but I think that is definitely where I aim to go, is kind of helping bridge these gaps and provide more knowledge, because as somebody who is newer to this community and knows what I know about my profession, um, it can be a very overwhelming process for trying to sort through how to find effective care for your child. And it seems few and far between, and I would like to help decrease that. So that kind of concludes my presentation. Um, I know that was a lot of information to kind of throw, um, but um, I think we are pretty much good there. Um, if anybody has questions, I would be more than happy to take those at this time. I hope I did good for everyone today. I was, like I said, I was really nervous coming into this, so I'm glad that I can just say what I know, and if it helps somebody, it helps somebody.
Well, I think you did a fabulous job. And I have a question to start us off,
Yeah.
just because I'm curious. So you mentioned that you want to use a toothpaste that doesn't have sodium lauryl sulfate. Is
Mhm.
that something that's common with toddler toothpaste? Like I've noticed that toddler toothpaste don't really foam up. Is that because they're missing that component?
I would assume so. I am
Okay.
not sure about I haven't had the chance to really use a whole lot of toddler toothpaste, but at least the ones that we give away in our office, it's a Crest toothpaste. I know it has the sodium lauryl sulfate in it. Um, but yes, if it is missing that foaming action, that's more than likely what it's missing. I think there are a couple other ingredients out there that have the same kind of deal, but um, that is typically the main one. That's the one found in, like, Crest and Colgate, so I
Does
see
anybody
there
else
were
have questions? You're welcome to type them in the chat box if you don't want to come off mute and ask out loud.
I saw there was a little thing about the PDF. I will email that to Stephanie so that she can get that out to the participants who,
And I will
can't.
forward that along to everyone. Todd, if you want to let your wife know, I'm going to wait until I get that from Sophia to send out the recording. So I'll send out the recording too, just in case anybody has questions. Sophia, I have another question. It may
Yeah.
put you on the spot. So if you don't know, I'm
No,
really sorry.
no,
I'm
that's fine.
just curious. Um, I have noticed that there are some folks within our community who get like sent through the expander route
Mhm.
early on, and then other folks within our community whose dentist never mentioned that to them. And
Mhm.
I'm curious because I feel like because a lot of folks with Down syndrome have the really narrow mouth, is that
Mhm.
something that parents should be asking about? I know, like with my daughter, our dentist had never mentioned it, but once I asked about it, our dentist was like, oh yeah, that'd be really great, we should do that. And so I'm just curious, like what should parents know about that?
I, one, really like that question because, um, that is an intervention. Um, I do kinda think that that has to do with at least a little bit of not gap in knowledge necessarily, but, what's the word I'm looking for? Like, not realizing something could be helpful for this person until a parent brings it up. Um, and it might just be that, maybe they think that the patient couldn't tolerate it or
Mm.
something to that effect. But yeah, you're right. It is really common to have that narrow and vaulted palate. So an expander really could be beneficial. And I think if a dentist hasn't recommended that and you notice that in your child, uh, unfortunately, that is part of the advocacy for your child is being like, "Hey, should we do this?" But I would say if if a pediatric dentist is taking every single step to do what they need to be doing for child, then I think that is something that should be brought up on their side. But I understand that doesn't always happen.
Interesting.
I
All right.
thank you
Oh,
for asking that, Stephanie, because I was kind of thinking of asking a question along the same lines of what are some of the common procedures you see in the Down syndrome community for kiddos, versus maybe more common than, I guess, other kids?
Um, I definitely say I have more than just the expander. Um, One thing I kind of actually forgot to mention this, so thank you for bringing that up, is that like sleep apnea, and because of that macro, like the bigger tongue, or not necessarily truly bigger tongue, but less space for the tongue. If you ever notice that your child is um, stirring in their sleep really frequently, if they are just all over the place when they're sleeping, if they're snoring, um, I think mouth breathing is pretty common. You can correct me if I'm wrong on that. I'm pretty sure it is. Um, that can actually be indicative of something tonsillar or adenoids. And I know that that is a really, really common procedure for patients with Down syndrome, is to need their tonsils and adenoids removed to kind of help open up that airway. Um, I know personally, I couldn't really tolerate a mouth guard. I would assume that children really don't want to tolerate a mouth guard for sleep apnea. Um, so I would say that us referring to an ENT for examination of tonsils is a really, really common one. That, and then what I had kind of said with the periodontal diseases, I see frequently, and it was kind of why I included so much about the general anesthesia. Um, I have a few patients that are a little bit more high special needs, and their parents really cannot do a good job brushing. There is not amount of home intervention they could do to help their child brush better. And at the end of the day, we as providers have to be compassionate about that, because us seeing you every, it could be a shorter recall or something like that, um, but the like deeper cleanings is something I see a lot of the time, just because parents are not able to complete the home care. Um, and I am definitely never one to shame about that. We're so stretched, like, I say I'm not even a parent yet. I understand people are very stretched thin as parents, um, and especially with a special needs child, you have to pick and choose your battles, and if it means not brushing your teeth for a night, I'm not going to get overwhelmingly upset about that. Um, it's just at the end of the day, seeing what we can do best for your child. So, those are really the only 2 that come to mind. Um, just yeah, the gum conditions and such is what usually tends to get really bad, just because of the immunocompromisation. Compromise I think that's a word, yep. And then,
Thank you.
yeah, absolutely. Just plaque accumulation, it can become really irritating, so
I have one more follow-up question to that.
yeah.
What about like a safe mouthwash or something like that? Is there anything out there like that?
Um, I know there are, like, you would be surprised, Listerine a lot of the time doesn't have fluoride in it. A lot of the time it's essential oil. So, really the only thing that would come from swallowing Listerine is maybe an upset stomach. I'm sure there is some level of toxicity there if you were to swallow a lot of that mouthwash. I am not entirely sure of a like completely safe one. Like if it were consumed, that's something I could look into and get back to you on, because I would be curious about that, because I know that the like Listerine and some of just the general ones that you can find in the grocery store don't have fluoride in them, um, which is where, you would be concerned with like toxicity. But I know that swallowing copious amounts of essential oils is probably not so good for you either.
All right. Well, Sophia, thank you so much. That was really great information. I'm going to go ahead and stop the recording now. Oh, go ahead, Susanna.
My son has braces on. Do you have some tips for to have them healthy? His gums.
Yeah, so I actually just had my braces on at the very beginning of my pregnancy, and I was like, please take them off of me. I want them off. I'm gaggy and wanted them off. So I have a couple good tips. If you have a water flosser, or if you know what that is, water pick, I'm sure that that might be something that they have recommended to you. I know that that can get very messy, and I talk about it with my pediatric patients all the time because that's one of the things that their parents are very deterred from is how big of a mess it can make. So, what I like to recommend is they have them on Amazon for maybe 15, 20 bucks. They're the like handheld ones. Like they don't have the tabletop feature to them. The water reservoir is actually it's all in one handheld thing. And then it has, the angled tip and everything. And I say do it in the shower, which sounds so silly, but it kind of prevents some of that mess. Even me with my water flosser, I still spray it on the mirror sometimes on accident. Um, but it creates a better situation if water is going everywhere. At least there's already water going everywhere. And then there is making sure that he's brushing on top of his brackets, at the bottom of his brackets. I didn't want to use string floss when I had my braces on. I don't expect any of my pediatric patients to use the string floss, but a water flosser can greatly help with some of that inflammation, especially if he has Down syndrome. Those gums are going to become irritated a little bit more easier. So just making sure you're staying on top of it. And I would also check his brushing if you don't already.
Okay, thank you.
Yeah, absolutely.
Excellent. Well, thank you again. I'm going to go ahead and stop the recording. We really appreciate all the information you've shared with us.
Yes.